Good morning, folks, and thanks for being patient with us. We just got offline with the Vice President and a number of governors going over some just recent updates and protocols. So, as you know, our highest priority is the safety, the health, and the welfare of Alaskans, and that's the forefront of all of our conversations. We've been working with our legislators as well, individual legislators. We feel that we are all on the same team, the administration, legislature, individual legislators. Doesn't matter what party you're from, whether you're in the House, the Senate, or the governor's office. We're all Alaskans, we're all coming together, and we're going to stay focused on making sure that Alaskans are safe. Resources will obviously be put forward to continue with testing. Dr. Zink in a moment will talk about mitigation efforts, but we are focused on making sure that Alaskans are safe to the greatest extent possible. Keep in mind that this coronavirus is a virus that does not appear to severely impact children, which is great news for everybody. In many cases, mild symptoms, but there's been no deaths reported for children. This virus seems to be an issue for older folks, especially with underlying health issues, which Dr. Zink will get into here in a moment. And that's where the deaths have occurred. Obviously you've heard that the cruise ship industry has been under discussion. I want to emphasize that what's being discussed right now is cruise ship industry as it relates to cruises occurring right now, especially in the Caribbean coming out of Florida. We don't get our first cruise ship till the end of April here in Alaska, which is going to give us time to work with the federal government, the cruise industry, and our own local communities. Once again, it's our Alaskans and our local communities that we're focused on to make sure that they are safe, that they are healthy. And so we will have time, and we have time, to work through the cruise ship industry issues before the first cruise ship arrives at the end of April. Again, seniors with underlying issues, we should be taking precautions with those individuals. If you are one of those individuals, one of a senior with underlying issues lives with you, of course, Dr. Zink here in a moment will lay out some approaches to dealing with individuals in that category. But the long and short of it is, we have the resources that we'll put forward to fight this issue. We're all working together, all Alaskans, legislature, governor's office, and various groups across Alaska. And we are going to advise that people use audio as much as possible to communicate. We will advise, the doctor will, basic sanitation, hand washing, don't shake hands if necessary. If you don't necessarily have to be in a large group, don't do that either. And again, the doctor will talk here in a moment about how to deal with any symptoms or where you go if you think you question if you may have this issue. So with that said, I'm going to turn this over to Dr. Zink, but I want to emphasize one more time. We've been working on this since mid-January. We feel that we have pretty strong protocols here in the state of Alaska. There have been 23 cases, individuals tested. As of right now, as we speak at this moment, no positives in Alaska. Obviously, this may change as this disease grows in the lower 48. But right now, we're in good shape. Again, we're going to have the resources, and we are putting resources towards this issue. We're going to be in deep conversations with the cruise ship industry. We're going to make sure that Alaskans, first and foremost, are protected, that their health and welfare is our priority. And we continue to work with the federal government and CDC, as well as other health-related agencies. So right now, I think we have a pretty robust approach to this issue, and we will keep you updated quite often. So with that, I want to turn this over to, I believe we're going to go to Adam Crum first, Commissioner Crum in Juneau, and then we'll go to Dr. Zink. And then after that, we'll be more than happy to answer any questions that you have. Thank you. Commissioner Crum?
Thank you, guys. Thank you, Governor. Am I coming through?
Yes.
So one of the aspects we're going to be focused on this week from the Commissioner's office is to dive into the package that was passed, $8.3 billion in aid that moved its way through Congress. So some particular items of that, there is $3 billion that is at the health secretary of HHS, his disposal, his discretion. Other items are $950 million for state and local health departments that must be dispersed within 30 days. And so we're working right now to find out, along with our federal delegation, what aspects of that will be coming into Alaska and when we can have those dollars to help our response. There are other aspects of this as well, to make sure that there is $100 million dedicated towards underserved areas. And so we want to make sure that our rural communities in Alaska are getting the necessary resources and that they can have to respond to this. And so we'll be focusing on that this week to find out how we can do this to help bolster up where our planning is, so other groups can understand how they can protect themselves coming out in the future. But just appreciate all of the attention and the governor's willingness to let our health team take lead on this, and the great work I just want to mention for the epidemiological team and the public health division with the emergency response. They've been going at this for 6 weeks now, and they've been doing a tremendous job. So I'll pass it off to Dr. Zink.
Doctor?
Thank you. So I'm Dr. Ann Zink. I'm the Chief Medical Officer for the state of Alaska. And I just really want to start off by saying thank you. There has been tremendous work and attention effort from the media, from public, from healthcare providers, primary care clinics, people who run senior and disability centers, mayors, boroughs. I could go on for a long time. And the work that I've seen happen over the last couple weeks, but particularly over the last week, has been fantastic as we all prepare together. I think it's incredibly important that we continue to work together. We're working closely with our federal partners, and I appreciate everyone's patience as we make sure that we're having consistent information and that we're making sure we're doing everything we can to prepare and keep Alaska safe. As the governor mentioned, we have no known confirmed cases in the state of Alaska. We continue to ramp up our testing. We have the capability to test over 500 people now and continue to expand that quickly. We're also working with the private sector and working with our state, hospital, and local authorities, as well as working with our rural areas to make sure that we're protecting and thinking about every Alaska. Again, the test is not a cure, nor is it a treatment, but it is a really important public health tool to understand the progression of this virus, to make sure that we're giving the best epidemiological recommendations to you all, to the governor, on how to keep people safe. And so that's part of the reason for ramping up testing, is to understand that. We have seen worldwide an increased spread of this disease. We've seen increasing transmission, and we're continuing to see that in the United States, particularly in 4 communities: California, New York, Florida, and Washington State. We're seeing increasing community spread, and we're watching that incredibly closely. We are fairly close. We're an airplane away from many of those communities, and so our epidemiology team is working closely with those communities to make sure that we're providing good, accurate information. There's kind of 4 main themes that I wanted to focus on today. And the first one is this, that we should expect more cases. We don't have any cases now, but we do expect more cases just based on the transmission of this virus. And so we are acting as if we had cases now. We're making sure our hospitals are set up to act if they have cases. We're asking people to have good hand washing and be prepared in case we have cases. We're trying to stay ahead of this, and we're acting in that way. The second thing is to really emphasize that the elderly, as well as those with underlying health conditions, particularly heart disease, lung disease, smoking, and diabetes, are at particular risk. This is a time for those people to think about social distancing, staying more than 6 feet away, not working with anyone or being with anyone else who is sick. They should also consider not traveling on long air flight as well as cruise ships. And so we're hearing that consistently with the CDC. Our elderly population are at risk right now, and we need to make sure that we're protected as we get more information out. So this is a time to ask those of us who are taking care of elderly to make sure that they're safe and protected, and to continue to work with each other to make sure that we're not taking a virus and spreading it into high-risk communities. The third thing to emphasize is that children are really low risk. The mortality rate for children is lower than the flu for children, and so we think our children are fairly well protected at this point. We don't have good understanding about the transmission of this disease, and something we're working worldwide on that, but I think it's just important to know that we really need to focus our effort and attention on those who are vulnerable, which is the elderly and underlying medical conditions, and children are okay from what we're understanding right now. The fourth is that the basics matter. And so the basics of what we do with good hand washing, staying home when we're sick, wiping off surfaces are incredibly important. They seem like small things, but when we look at pandemics in the past, those aren't cured by a vaccine. They're not cured by a treatment. They're cured or ended by people working together with good hand hygiene and germ prevention. And so while it seems simple and it seems repetitive and it seems redundant, it's incredibly important that we do those basics incredibly well. Paul Petzl said you can't climb Everest without being a good camper. I think the same is true here. We can't stop a pandemic without doing good basics. And so really asking everyone to do those important things is incredibly important at this time. So happy to take any questions, but really appreciate everyone's
Tell
patience.
you what, we'll go ahead and start here in the room, and I'll call on you one by one. Nat, APRN.
Yeah, Nat Hurst with Alaska Public Radio Network. This is for Governor Dunleavy. This is sort of a big picture question, and I had to write down some notes to remember all the different bad things that are happening right now with like oil price crash, stock market crash, questions about permanent fund returns, cruise ship industry, like lots of sort of bad headlines. What does all that mean for, in your mind, for sort of the legislative session and your kind of budget proposals? Like, are there going to be any changes?
Great question, Nat. So first of all, it's not the end of the world. I see these things as a momentary glitch. I see this virus as a momentary glitch. I see oil prices, the drop in oil prices, as a momentary issue. And let me talk about oil for a moment. So Alaska's oil industry and our conventional fields means that we're in oil for the long haul. We have investment that's in for the long haul. We have conventional pools of oil up there. So we still anticipate that over the next several years, we'll see an increase of 200,000 to 300,000 barrels of oil come online. So the investment horizon in Alaska is much longer than other places such as the lower 48 and the fields that are that fracking is used. So we don't know how long this price war will last between the Russians and the Saudis, and surely it impacts us, especially in the short term. But if the oil prices turn around here in a few weeks or even a month or two, it's all going to be averaged out in terms of our oil revenue. And so I see it as a momentary glitch. It's something certainly to watch, but nothing there to panic about at this point. We will be in conversations with the legislature like we have been. At 50, basically oil in the 50s, we were still going to have a deficit that would need to be filled by savings. We have to have a continued conversation as to how big our government is going to be going forward, how much we can afford. But I would say this is definitely a momentary bump in the road for Alaska. Again, our oil patch is in it for the long haul. With regard to the stock market, I too believe that the underlying fundamentals of the U.S. economy is pretty strong. And it's being impacted now by the coronavirus. There's an impact on the economies worldwide at this point, but that's a momentary issue. That's going to be temporary as well. And again, the underlying fundamentals in the U.S. economy, I believe, will result in the economy coming back pretty strong. I think sooner than later. I think the stock market's going to come back fairly strong sooner than later. We have really good people running our permanent fund and investing our permanent funds, so they're on top of this, and they're making sure that we're maximizing our gains in the permanent fund. So again, it's a momentary issue. Priority right now is dealing with the coronavirus, across the country, across the world, here in the state of Alaska. But again, I think our protocols are in really good shape. Oil will work itself out, and the stock market will as well. We just have to make sure that Alaskans take care of themselves from a health perspective, and I think the rest of it we're working on, and we'll point the ship in the right direction, and we'll be in pretty good shape.
So no quick sort of changes to your
No
budget
knee-jerk
or
reactions,
something
no,
like that?
no, and it's not the end of the world.
Aubrey.
Yeah, this is a question for Dr. Zink. Over the weekend, we saw other states increase their testing and realized that the virus was much more prevalent in their state than they had thought before that. Can you give a little more information about how Alaska has ramped up testing, and what do you think the chances are that the virus is here, it just hasn't been tested yet?
Yeah, it's a great question. So testing is a way to survey, but it's also a way to make sure that we are kind of isolating, containing people who may have the virus to make sure they don't have spread to others. So it's an important part of it. We've been slowly ramping up our testing in combination with the CDC. When we think about testing, there's a couple components. So it's, first of all, we have to have the personnel who are protected who can do the test. We have to then be able to get that to a place to do the test. We have to have the reagents to do the test, and then we need to be able to get that information back. And so it's a really multi-pronged system that we're making sure is stood up together. At the State Department here in Alaska, we have been moving kind of ahead of the CDC recommendations and loosening testing for some time now. So we sent out a health action alert advisory last Thursday that was broader than the CDC to encourage clinicians to test. We are right now running at least 4 nurse epidemiologists on call 24 hours a day, 7 days a week to help support clinicians, and are trying to be quite liberal with the testing. Again, it's important to remember though that going to the emergency department right now, just because you have the sniffles, isn't a reason to get tested. And the test is at one point in time. So you may test negative now and then be exposed and then get it later, and it's going to be more important at that time. So we need to make sure that we're doing the test on the right people. And so we're working really closely with our healthcare providers to make sure that the right people are getting tested. We continue to ramp up partially in surveillance as well as a way to kind of make sure that we are expecting this virus coming here. I don't have any data to say, I expect X% of the people to be positive or not. I do know that we've been testing fairly aggressively and liberally, and we haven't seen a positive to date. That can change rapidly. We are increasingly batch testing, so we're batching more people at the same time. That helps our reagents last longer, so with the same amount of supplies, we're able to do more testing. We're also seeing these different private industries getting online, and so we're talking about what ways we can be able to utilize that support. That turnaround time is a lot longer than the state turnaround time. Our state turnaround time is potentially the fastest in the country right now. We're able to get turnaround times quite quickly because we've been ramping up for some time, and that's very reassuring. That's thanks to the incredibly hard work between our epi and lab team as well as our healthcare partners.
Hank, Channel 2.
Hank Davis, KTOU. I think this might be a question for Commissioner Crum, but I know we're concerned about Anchorage being a travel hub, cruise ships in the southeast. What about rural Alaska? Can we talk a little bit more about the procedure with rural Alaska and assessing the virus in areas like that?
We were just talking about that this morning, so maybe both the doctor and
Commissioner?
Yeah, thank you for the question. One of our initial asks of resources that the governor put forward for the department was for getting extra public health nursing. And so we have been working towards hiring those individuals to make sure we've got more people that can fly out to do systems capacity and community engagement in these rural communities. We have had a lot of phone calls with municipalities, with different health consortium CEOs around Alaska, giving them as much technical assistance as possible. But we're looking forward to having some boots on the ground to really see and assess the situations that they have, to talk them through this process. Alaska is a very big state, and so every area, every town and region is going to have unique capacities and or situations in order to deal with. But it's just something that of the 9 tactical groups working in the Emergency Operations Center, rural access, the transportation, the possible quarantine, these are all things that they're tackling right now. So we have, we're working through these plans, and we hope to be just really be out there kind of talking with individuals so they can see the work that we've been doing.
I would just echo what the commissioner said. Exactly right. We've got numerous tactic groups. Rural is a focus of every single one of them, but we have a specific focus on rural as a specific task force itself, thinking about housing, thinking about transportation, thinking about testing. Part of our request was specifically for public health nurses, thinking about our rural areas. We also requested 3 additional epidemiologists to support clinical decision making so that we can be able to support them. We're also looking at telemedicine and telecommunication and ways that we can support people both by doing text messaging to keep them at home, being able to do video chat. We've been working with the community health aides. We've been working, as mentioned, with all of our kind of both tribal as well as rural colleagues to be able to support across the state what this looks like. Every single person in Alaska is incredibly important. And while we have to think about kind of flow and volume in places like Anchorage, that is one component, and we need to think about very carefully what we're doing in the rural areas to make sure it's supported. So it's a huge part of all of our conversations.
Lauren?
Lauren from KTBA. I just wanted some clarity on numbers. So we've requested all this money to fund these positions for extra public health, or we've received some money already, or do we know how much is coming? Are there some figures for that?
Yeah, I'll take that one. So we did, the government put forth a resource request for $9 million in federal receipts and $4.1 million in general fund dollars for the state. So that is being worked through the legislature right now. We did receive funding from the CDC to help us engage with this, and it was a very broad what they would allow us to do. So we have received federal funds to help us sustain this effort currently. Our hope is with the federal bill that was just passed, they did put tight timelines on how fast the dollars must be dispersed to public health departments around the country. And so we will be assessing that this week when we get the full documentation about what is the process for getting those dollars in the door. And so it's going to be an evolving thing as these If the dollars from the feds come in for certain programs, we're going to make sure that if there's funds allocated to tribes or tribal regions, that they have access from technical assistance from us here at the state to make sure that they can help with their response. And any dollars that the state does receive from the feds, that we're going to make sure that we have got equal access around the state to make sure that the response is taken care of.
What was the initial CDC funding that we got? How much was that?
I believe it was around $4.5 million.
Okay, and just one more quick question. In terms of the testing, you said the state now has the capacity to test 500 people, but so far we've only tested 23, is that correct?
So, yeah, what we're doing is we're working closely with clinicians, and if they think someone is at high risk or has symptoms, and that data changes almost like every 2 to 3 days, we change those guidelines. If they call us and think someone needs to be tested, we help facilitate that testing, so they're able to go ahead and do that testing. We have seen just a really steady increase in testing even over the weekend. So initially it was a few cases. Part of it is just making sure clinicians are aware of who they should be testing. Part of it is making sure that they can adequately test in a safe way that doesn't put healthcare providers at risk. And part of it's getting testing out and available. And again, we're trying to keep ahead of it so that while we have the capacity to do that, there are some limitations in just the number of lab staff. So we couldn't run 500 tests today, but right now we don't have a bottleneck at the lab. What we are doing is we're testing all the cases that we think meet criteria and are appropriate, and are working closely with our clinicians.
Okay, thank you.
Okay, let's go ahead and go to some questions online. For the reporters, please keep your phone muted until I call out your name. Let's go ahead and start in Fairbanks with Aaron at the Fairbanks Daily News Miner. Aaron, did you have a question?
My question was actually about how many cases had been tested, so that's already been answered.
Okay. Sarah, KTVF?
My question was already answered.
Okay. All right, let's go to Juneau. Peter Siegel at the Empire.
Yes. So there's been a lot of reports that there is a shortage of testing kits, and it's hard for people to get tests. So what are the actual ways that the state is testing people, and how widely dispersed are they? Are they in Anchorage, are they in Juneau, Fairbanks, et cetera, things like this?
So yeah, this is Ann Zink. I appreciate the question. So again, you have to have the personnel in a safe place to be able to test it. And then what we do is we take the samples and we send the samples to the state lab. So that's the process in which that goes. It's a complicated test that our hospitals cannot do at this time. So it either has to be sent out of the state to one of these private labs, or it has to be done at one of the 2 state labs. We have 2 state labs, one's in Anchorage and one's in Fairbanks. So the process that happens like in rural areas is the test is done in a rural area, the patient stays there, and the test is then flown to either Anchorage or Fairbanks, depending on flow, and then we call that information back. So we're not moving people around for the testing, we're actually just moving the test sample to the right place to be able to do it. So there's some clarity from that perspective. The hospitals in Southeast and our rural communities, they don't have, really none of our hospitals have the ability to do this test, running that test at their facility. It can again only be run at these 2 state labs, but they can all do the actual test, a swab. So they can do the swab, send the test sample in, and then the PCR testing is done at one of the state facilities. So there's kind of 2 parts of the test, actually collecting it and then actually running the test. So there's 2 parts of that. We are just working with clinicians across the state to be able to get that testing up and available, and being able to encourage them to do it if they think that there is concern. The people who are at highest risk are someone who has known exposure to someone who has COVID-19. So if someone has recently been caring for someone who has COVID-19, they're staying with a loved one, we're going to see increasing those cases, particularly as we see increased exposure in the lower 48. So that's one group of people. Their symptoms need to be consistent with COVID-19, so they need to have fever, chills, cough, shortness of breath. Clearly we're not testing someone who has a broken ankle or something totally separate. So it's really important that we're testing people who have symptoms consistent with it. We also need to think at higher risk populations. So again, the elderly, or those with underlying lung, heart, or diabetes, and those who are being admitted to the hospital who don't have another clear definition, and those who have traveled to places that have high risk. So again, the CDC is updating those, but if someone has recently traveled to South Korea, if they've recently traveled to Italy, if they've recently traveled to China, those places we're seeing sustained community transmission, and so if they've traveled to those areas in 14 days. So those are the generalities of the guidelines. They're a little bit more specific when you get into what the healthcare providers, and we're using things like looking at what's happening in Washington State, So if someone had been in Seattle in the last 3 days and they had significant symptoms, including fever and chills, that's a layer that we have added to our testing. We have a way of sending that out to all clinicians so that they know to look for those things. Again, it's important to call your healthcare provider, call 211, call Teladoc, call whatever service you have before you show up. We would hate for someone to go into the emergency department and wait there for a long time thinking they need the test and get the flu or get some other disease in the process, and we really don't want to overwhelm our healthcare system at the same time. So we really encourage everyone to take a deep breath, to call your healthcare provider first, and help us to be able to screen where you should go and how we should get the testing done. I know it's complicated. There isn't one spot to just go and people to do this across the whole state, but it is really important that we do this in a phased approach to be able to protect each other as well as protect our healthcare providers and make sure we're doing the right test on the right people.
Okay, let's continue with Juneau. Charles, KINY, did you have a question?
Yes, good morning. Governor, could you respond to the State Department directive urging U.S. citizens to not travel on cruise ships? And you mentioned that might affect the Caribbean cruises more than Alaska. Could you kind of elaborate on what you meant and
Sure.
any predictions you have on Juneau?
Sure. Predictions I have on Juneau? Well, talking about the cruise industry, again, you have cruises occurring constantly coming out of, for example, Florida going into the Caribbean. Our cruise ship season really doesn't start until late April. And we anticipate 37 ships coming to Alaska this summer. And so we have a defined season that lasts several months. It's pretty intense during that time, but it's our belief that as we work through this response to the coronavirus, that there are going to be protocols that are going to be developed, put in place. Our cruise industry folks here are in constant contact with the feds, with us, as well as with the cruise industry in Florida, where it's based. And so it's our belief that we will have time to make sure that we have once again, a robust approach with the cruise line industry. Again, the most important focus for us is going to be on our Alaskans and our communities. And I want to assure those communities that receive cruise ship passengers in cruise ships that we are going to make sure that before the ships come in that we've done everything, we've done all of our due diligence, we have protocols in place, protections for Alaskans first and foremost. But again, we're fortunate we have some time to make sure that these protocols are developed, tested, put in place, and again, gives us time to have conversations with everybody involved.
Okay. Becky, Associated Press.
Thank you. Commissioner Crum, can you talk about any additional restrictions, if any, that the department has placed for Pioneer homes or for private nursing homes in terms of vigilance, restrictions on visitors, those sorts of things?
Well, thank you for that, Becky. We have been putting in place some protocols about when and what time do we need to just advise against visitors coming. So we're going to have in some departmental discussions the next today and tomorrow, and we may be reaching out, and we already advised individuals who are sick from coming in because we're debating about putting up signs saying, let's avoid some of the contact issues with the Pioneer homes. We do have already sent guidance to all of our SDS senior and disability services. We have a means of putting out notices to all of the providers, the personal care attendants, to the Medicaid payment system, advising them on issues. And so we're going to be talking about this. And as we look at this week and we see very clearly now from the data what that vulnerable population is, we're going to make sure that the groups that we work with and have a little influence on, we want to make sure we're protecting them as best as possible. So as we look at this week, we might be sending some additional guidance out to some of those assisted living facilities and nursing homes.
Okay. Let's go ahead and change location. Tim at the Frontiersman, did you have a question? Okay. Hearing none. We'll go back to Juneau. Andrew, KTOO. All right. Let's go back to the room here. Hank, I think you had a follow-up?
Yeah, I know that obviously there's going to be a significant difference between the time it takes to get a sample from someone here in Anchorage to a lab and get the results versus Kotzebue. But once that sample is in the lab, how long will it take to determine, okay, we have a positive or a negative result? How quick can you guys make that turn?
So thank you for that question. Again, it depends a little bit on flow. So currently, as of today, we've got capacity to do testing. The test itself takes somewhere between 3 to 5 hours. We're saying about 4, depending if it's done in Fairbanks versus Anchorage. So it's a more automated process in Fairbanks versus in Anchorage, it's a little bit more of a manual process. So it tends a little bit more on the actual number of people. It also depends on the batch time. So again, we're trying to run more samples at the same time to preserve our reagent to be able to test more people. And so if we're able to batch, so that will be able to extend that. If we got a test at say 9 a.m. and the batch runs at 10, then hopefully be done by 2, but so for the clinician that's gonna look like 5 hours even though the test only took 4 hours to run. We have the ability to increase our batches, and so we can do more batches per day if needed, and we're working with our providers and kind of just seeing what the volume looks like, trying to be respectful of our resources and make sure that we're not running through them all at the same time. We also have the ability to do stat testing. So if we really think a community or a certain person is of high concern, it still takes about 4 hours to run, but we would do that outside of the typical batch process if we felt like there would be a big clinical decision that would be made. It just uses more reagent, so it's kind of a risk benefit. Our team has stood up 24 hours a day, 7 days a week, prepared to do that. We have been doing stat testing throughout the weekend, as well as batch testing throughout the weekend. Both our lab and epi team have been working closely all weekend. We'll continue to escalate that testing ability.
Time for a couple quick questions. Aubrey?
Yeah, this is for the governor. Previously, Heidi Hedberg had said a positive result would be released to the media within an hour of it coming. Is that still the case? And what other information would come along with that as far as age of the patient, sex, geographic location?
This is really going to be a question for the doctor because we're talking about potentially some HIPAA issues too, but go ahead, Doctor.
Yeah, so when we get a test that was positive, it's called a presumptive positive, but we would release that information prior to sending it for confirmation testing at the CDC. The details on the testing, again, our first and main obligation is to the health of all Alaskans, and that includes the Alaskan that tested positive, the healthcare providers who care for them, as well as that community. So depending on the nature of that person, so say this was someone who just flew here, had no community exposure, went right to the ER, got tested, we wouldn't announce that to that community because we wouldn't see that as a community risk. That would be very different if we saw a community spread that had no close travel history and we felt like the community was at risk. So while I would love to say these are the exact people that would be notified, it would really depend on the nature of the person itself that got tested positive, because we're thinking about the nature of the person, the healthcare providers, as well as all of Alaskans, and we would release any information that we felt like would be useful for that. We also are very mindful about protecting people, and we have seen misinformation, judgment, fear, and stigma, and people really acting not in kind ways towards people who test positive or may have come from other areas. And so we're very mindful of that as well. We really want to make sure that all people in Alaska are cared for. Our hope is to get that information out to you as quickly as possible. An hour would be our kind of outer time frame, but again, our first primary goal and objective is to protect that person. So talking to those healthcare providers would be first, and thinking about that, and then thinking about the larger community. But we don't want to keep anything from the larger public or from the media. We'd be working closely to get that information out largely as well.
Okay, last question. Matt?
I was wondering, maybe specific to the governor's office as one example, but also more broadly among the whole state workforce, what kind of contingencies have you guys sort of planned for as far as like, are people ready to work from home with laptops, that kind of thing? Is that sort of been done state government wide at this point, or just at sort of specific levels?
Very good question. So we are having those discussions about telecommuting, teleworking. And it's a large state, and we have a lot of remote communities with state workers that pretty much do that now in small offices or from a home office. So we're having that discussion now to see how we can expand that in the event that this virus comes to Alaska and spreads. So we'll be getting you more information on that as we work through some of those steps here in the next several days. And I think we're going to be well prepared to deal with this.
Thanks.
Oh, you want to?
I guess I just want to follow up on that. I guess I would really encourage all businesses to be thinking about this right now. We may have to go to a place where we're encouraging more people. We're seeing many industries saying, let's do telework, let's do telecommunications. So we're talking a lot about the state. We also encourage other people to be considering their own contingency plans, what this looks like, particularly if you have vulnerable people who work for you. We also understand that there are many communities and many businesses that cannot do that. For example, our healthcare industry, you can't really run an ER via telemedicine, but we can support it in other ways. And so thinking about what ways ways you can work online, support each other, and what ways we can support and think about communities and businesses keeping up and running.
How soon, if we have a positive test, do you expect that those kinds of recommendations are something that would happen almost immediately, or would it be sort of once we see a broader spread in the community?
It would depend on the nature of that case. So again, if this was a travel imported case, that would be very different than if we were concerned about a larger community spread. As mentioned, the state is quite large, and so the examples and what we might do in Juneau may be different from Anchorage, or might be different than Bethel, depending on where we saw that case. Again, a phased and layered approach, I think, is a very reasonable and mindful approach so that we don't overreact and we don't panic, and we're really doing this that is in the best health and interest of all Alaskans.
So I just want to reassure Alaskans that we're on this. We got this. We've been dealing with this since mid-January, when the first flight where individuals contacted us from the State Department to bring in individuals from Wuhan. And I think we handled that very well. There was no one on that flight that tested positive. We dealt with it well at the airport. We started to develop our protocols at that point to make sure that we filled in any holes that we had in our emergency procedures. We've been working in some cases daily, many hours a day on this as a team, our response team, and working very closely with the federal government, CDC, as was mentioned, municipalities, tribes, other organizations. We're working with the cruise ship industry right now as we speak to make sure that when that season starts, that we are prepared to guarantee that our folks are safe here in Alaska. I would caution people, as we were talking earlier, this is nowhere near the end of the world. This is a coronavirus. As was mentioned, young people, children don't seem to be impacted as older folks with underlying issues. That's the group that we're focusing on. We have resources from the federal government and from the state. I want to commend and thank the legislature for stepping up very quickly. There was pretty much a lunch and learn down there for all 60 legislators here last week. Some excellent questions. And what that highlighted is, in times like this is what makes Alaska different. We all pull together. There's no difference between the legislature and the governor's office. There's no difference between Republicans and Democrats. The legislature is committed to looking out for the welfare, health, and safety of Alaskans, as we are, and we continue to work together. So we're going to work together as Alaskans. We pull together during times like this. With regard to the oil issue, again, I see that as a temporary issue. There's not much control we have over that here in Alaska, but we're going to follow that. Well, of course, we'll have discussions with the legislature on how that may impact budgetary considerations moving forward. The market, same thing, but we got some terrific folks at the Permanent Fund that have proven that they know how to invest. And so I think our Permanent Fund is in good hands. But again, I think these are temporary issues. The underlying fundamentals of the economy of this country, again, it's 2020, and also the underlying fundamentals of our healthcare system in this nation are terrific. I mean, this is 2020. It'd be a different story if this was 1500 when we're dealing with some other type of pandemic. But this particular coronavirus, I think we're addressing well with best practices. And as was mentioned, as Alaskans, we can do some simple things. Wash your hands. Don't necessarily shake hands. If somebody has the sniffles in the house, stay home. If you have a elderly friend or relative, you may want to just telecommunicate with them until we get through this process. So there's some simple things we can do as Alaskans that I think will really impact us in a positive way. But in terms of the stock market, Permanent Fund, and the virus itself, we're going to get through this. We'll get over it because the fundamentals of this country and this state are pretty solid. So I want to thank you all for being here. We'll keep you updated here quite often. Have a great day.